Are you ready, Avil?
Yes, sir.
Okay. Yeah. Once you are ready, you can start. Okay, you can start your video also.
Okay.
If you are comfortable, you can start your video.
Yes.
Otherwise, no problem.
Yes, sir.
Yeah. Yes, you
Can
can
I
start.
start, sir?
Yeah, of course.
Good afternoon.
Good afternoon, nurse.
I am Avil, one of the registered nurses in this hospital ward. Could you please detail me your name?
My name is John, and
Okay,
one
Mr.
sec.
John. Yeah.
One second.
Okay. Sir.
Patient hospital ward. Yeah. Yes, you can start.
Okay. Good afternoon.
Good afternoon, nurse.
I am Avil, one of the registered nurses in this hospital ward. For the verification purpose, could you please detail me your name and age?
My name is John, and I am 40 years old.
Okay, Mr. John, thanks for confirming your details. And you seem a bit uncomfortable, Mr. John. May I know the reason for that?
Yeah, of course, nurse. I'm very much concerned about my condition. You know, I had an acute attack of asthma last night, and my family brought me here to this emergency department, and I have never
Okay.
had an asthma attack before this one. And currently, I don't know why I'm being held in the hospital for overnight for observation purposes. And I wanted to be discharged from hospital within 2-3 hours, but I realized, and yeah, that's not possible.
Yes, Mr. John, that's quite reasonable from your part. As you told, you came yesterday as asthma attack, but do not worry. We all are here to support you, and we will take all the precautionary measures to keep you safe, Mr. John. Do not worry about that. And before proceeding further, do you know anything about asthma?
I don't know anything, nurse. I would be pleased if you can explain me everything about it. I want to know about
Yes, Mr.
asthma,
John.
its causes, and how it can be treated. I have heard stories about people dying from asthma attacks, so that's why I'm worried.
Yes, John, that's quite reasonable from your side. Let me explain you in detail so that you'll get a better clarity about your condition. So shall I proceed with that?
Yeah, of course, nurse.
Okay. First of all, asthma is nothing but it's a chronic disease of the airways, which will affect in the respiratory system. There are couple of causes, like environmental causes, which will be caused by environment, such as dust and air, and also finally inherited predisposition, which will be from genes. Genes will play a crucial role here, from transferring mother to baby, so it will play a crucial role there. Do you understand so far, Mr. John?
Yeah, of course, nurse.
Okay, Mr. John, there are some treatment, for example, the Ventolin inhaler, which will be prescribed by physician, and he will guide you. You can use at what time, and he will let you know the usage of the Ventolin inhaler, so that your asthma will be cured in a shorter time. And also you mentioned, Mr. John, as some people will tell regarding their misuse of asthma. And let me tell you my story, because I had asthma when I was at your age. So people will tell everything about that, about that medication. But the thing is, I relieved from this medication only. I went to hospital, and I got early treatment, and now I don't have asthma, Mr. John. You can test me, and you can try this medication, Mr. John. Is that comfortable with you?
But I'm anxious about the proposal to use a Ventolin inhaler because people have told me about its misuse. So I don't want to use it in spite of whatever you are telling, nurse.
Yes, Mister. I can really understand how difficult it must be for you. But you have the only option to take a Ventolin inhaler, because in your case, the inhaler will help you to relieve the asthma. Please understand that. And the concerned person will come, and he will prescribe the medication, and you can take that medication, Mr. Chan. Is that clear with you?
Yes, of course, nurse. And now that I
Okay.
have been held overnight in the hospital for observation and I had an asthma attack, and what are the long term prospects?
Yes, Mr. John, that's quite reasonable from your side. There are some, long-term prospects which will be happen if you are not following our doctor's orders. So I'll tell you, like I'll strongly recommend you to follow the doctor order, and the asthma with medication. If you're following doctor's orders, and on a daily basis, asthma will be relieved, Mr. John. Are there any concerns in that?
Yeah, that's very clear, nurse. Thank you for your valuable suggestions. Is there anything else that I need to know?
Yes, Mr. John. I strongly believe that I have given you the relevant information, necessary guidelines, and appropriate measures with the best of my knowledge, experience. And if you have any other concern, please do not hesitate to ask me. I'm ready to help you, whichever falls within my understanding. So, is that clear with you, Mr. John?
Yeah, that's a fine, nurse. Thank you very much once again. Have a nice day.
Okay, Mr. John. Thanks for patiently listening to me. I wish you a speedy recovery, Mr. John. Thank
R-
you.
Right, that's very nice. And yeah, Avil Kenvit, here is your feedback. Here is your feedback of the session. First thing is excellent flow of speech. The way how you are speaking, the flow is very nice. It's progressing in a proper manner. There is no problem with that one. The flow of speech, the way how you are speaking is very good. And next, sound knowledge about the subject. Sound knowledge about the subject. Sound knowledge about the subject. Now, what is this sound knowledge about the subject? For example, regarding asthma, okay, acute asthma attack, you have a lot of information regarding that. What is the condition, how you have to deal with that one, what are the possible options, what are the measures that you have to take, what are the guidelines that you have to provide, everything, all the information you have well in advance on your mind. So no, you have done a good job by passing on the information. Next one, smooth progress of the dialogue. From the beginning to the ending, the dialogue has been progressing in a systematic way without any hindrance or getting stuck somewhere. So that's fine. That's a good sign. But the problem with you is Mr. John, Mr. John, Mr. John, multiple number of times, multiple times you are using this one. So that doesn't sound very excellent. That's a weak area. So you have to focus on that one. Then next one, the style of delivery is very excellent. From the beginning to the end, the progress is very smooth, and the reason for step by step, point by point, you are explaining very clearly and making the other person, even if it is a new person, he can understand your situation very well. You are developing the plot wonderfully. You are providing the plot wonderfully, right? So that is very, very important. That is very, very important. So next one, high level of confidence. High level of confidence you are exhibiting. High level of confidence you are exhibiting. So that's very, very, very essential. That is very, very essential. That's what I'm telling you. So what you are supposed to do is, so practice more sessions like this and implement quality, perfection, display perfection, implement quality, and show your level of confidence as usual. That will definitely promote you in the long run. And yeah, you're doing well. There is no doubt regarding that one, but still there is some room for improvement. Like every time there is always room for improvement. There nobody is perfect. No one is a master, and so there is lot of chance for you to improve. So work hard and try to create some quality sentences. For example, you could have said like this: if I were in your position, or if I were you, I would also behave in the same way, because I'm a human being. So I will react in the same way. It is a common problem. It is a common problem. And there is no need to worry about this. There is no need to worry about this. It's a very common problem. Yeah. So for example, if you want to talk about the same thing, yeah. So there is nothing to worry. There is nothing to worry, because it's a very common problem. Yeah, there is nothing to worry because it is a very common problem. Asthma, what is asthma? Asthma is a chronic disease of the airways. Okay. There are many reasons for this, such as environmental factors and inherited predisposition. For example, genetics is one reason. If the parents have asthma, the child possibly he may get asthma or he may not. 50-50% chances are there. Or it may be because of various triggering factors like coldness, then for food habits, or the area, the location, and then, for example, any particular trigger may be there. Because of that, you may be experiencing. Okay. Um, so if the suggested measures are implemented appropriately, if the suggested measures are implemented appropriately, then definitely you can manage the condition well and lead a normal life as any other person in the world. So no need to worry at all. Focus on the action plan It's very ordinary. You can manage it. Many people are managing, so you can equally manage the condition. In case if you have doubts, you can ask me. I'm ready to clarify all your doubts. So this is the way how you are going to speak. And then you can also say like this. Asthma can be controlled or asthma can be managed. So if care is taken and the suggested measures are implemented, no doubt you can lead a normal life and the asthma can be kept under check. So the conditions will not deteriorate further and the condition will be under your control. It is in your hands. So like this, you can try some quality sentences. Is that clear, Avil? Yeah. Do you want to say anything?
Yes, sir. As I said, instead of Mr. John, what can I use? Like repeated times?
Why do you want to say Mr. John?
No
Why do you
need.
want just to speak normal? Only one person is
Okay.
there. Did he
Yes.
forget? Did he forget his name?
No, no,
Do you think that he forgot his name?
no, sir.
Or do you want to remember his name every time?
No, sir.
Is there any benefit in saying Mr. John, Mr. John, Mr. John multiple times?
No, sir.
Then why? Forget the name.
Okay.
Name is there only to confirm whether he is the right person that you are talking to or not.
Yes.
So that's the only reason. Once it is confirmed that you know the person who you are talking to, there ends the matter.
Yes.
Every time you need not tell.
Okay.
Only at the starting point you have to use the name of the person. Afterwards, there is no need to continue with the name. Is that clear?
Yes,
Yeah.
sir.
So how was the session and how did you get the feedback? Were you satisfied with what you're getting?
Yes, sir. Really
Yeah.
satisfied with your clarification, sir. I'll
Share
try
your
to improve in next speaking session.
share your experience.
Yes, sir. It's really amazing, sir, because I was, I was not having that much confidence, but now, with practice, I'm having confidence. And your suggestions are really improving, sir. Thank you so much for that.
Okay, fine. That's good. So send me your letter, which letter you want to get corrected. So I will call you for letter correction afterwards. Now the
Okay.
speaking sessions are going on. Okay. Your video is
Okay.
there on the YouTube and with Otter.
Okay.
Afterwards, you can watch them and you can make notes of that one. Okay.
Okay. Okay.
Yes, that's fine. That's
Okay.
fine.
Thank you.
Yeah. Next one. You can stop your video. Yeah. Srija Ravindran. Srija Ravindran.
Yes, sir.
Srija Ravindran. Next is your turn. Okay.
Which card I have to prepare, sir?
Your wish. I sent 17 cards. Any card you want to take. Your wish. There is
Okay, sir.
nothing called this or that. You only remember and practice.
Okay.
So, yes, Avil Kenvit. So you have to join again in the same link, okay? Because you will have a separate session for yourself. Right. Vinita. Hello, Vinita. Yeah.
Yes,
Vinita
sir.
Mol. You can attend, you can do one speaking session also after her. Okay. You can also do one speaking session after her if you are interested.